Hi, my name is Marc Bates. I'm a metabolic health coach, and today's topic is questioning the plant based paradigm, the rise of the carnivore diet. Okay. What if the plants you've been told to eat are the source of many modern diseases? This question is at the heart of a growing scientific debate about human nutrition that challenges decades of conventional medical wisdom. The discussion revolves around the role of plants in our diet, with some researchers arguing that the plant based diet we've been encouraged to adopt might not be as beneficial as previously thought, and others advocating for a more balanced approach. While your doctor recommends plenty of fruits and vegetables, a growing body of clinical evidence suggests a meat based carnivore diet empowers you to take control of your health and resolve conditions that conventional medicine struggles to treat. The medical establishment's resistance to this approach reveals more about institutional bias and outdated training than scientific evidence. Okay, the evolutionary case for carnivore. Dr. Anthony Chaffee, a medical doctor in Australia, a neurosurgical resident and former professional rugby player, argues that humans evolved as apex predators for millions of years. According to the biological law of adaptation, organisms are best suited to consume the foods they have been exposed to for the longest time. We are best equipped to eat animal foods. We have robust evidence that people were thriving in the Arctic circles during the ice ages, Chaffee explains. We had people traveling by foot across the land bridge from Asia to North America in the last ice age. Plant foods were scarce or non-existent in many human habitats during these periods. Our ancestors survived and thrived on animal-based nutrition. This isn't merely historical speculation. Our digestive anatomy tells a similar story. Humans have relatively small colons and simple digestive tracts compared to herbivores. We lack the specialized fermenting chambers that true plant eaters used to break down cellulose and extract nutrients from fibrous plant matter. Instead, our digestive system more closely resembles that of carnivores designed to process animal protein and fat efficiently. Plants fight back. Unlike animals, plants can't run away from predators. Instead, they engage in what can be described as chemical warfare to deter consumption. They produce various defensive chemicals, from bitter-tasting compounds to toxic substances. Scientists have identified and cataloged approximately 1 million defensive chemicals that plants use to deter consumption. These compounds are found not only in poisonous plants, but in varying concentrations in all plant foods, including those considered healthy. Naturally occurring plant chemicals comprise 99.99% of all pesticides people consume in their regular diets. For sensitive individuals, these compounds may trigger inflammatory responses and autoimmune reactions that manifest as chronic disease. This perspective challenges the foundation of conventional nutritional advice. It suggests that the very foods we are told to eat more of might be harming many people. Clinical advice that can't be ignored. The theoretical arguments for carnivores gain credibility from mounting clinical evidence. According to a 2021 Harvard study that surveyed 2,029 participants following a carnivore diet, 89% reported improving or resolving their autoimmune disorders after at least 6 months. The same survey found that 95% of respondents reported improvements in overall health. These aren't minor improvements. Many participants experienced complete resolution of conditions that conventional medicine considers incurable or manageable only through lifelong medication. Dr. Chaffee reports seeing multiple sclerosis patients not only reverse their symptoms, but also reduce their lesion burden by over 50%. right? An outcome rarely observed in conventional treatment. Congestive heart failure patients with the ejection fractions below 15% have returned to normal cardiac function within months. Chronic pain patients who have been dependent on opioids for years have eliminated their need for medication. These clinical outcomes demand attention, regardless of one's position on evolutionary biology or plant toxins. Okay, real quick, if you would like, subscribe, hit the bell button to get notified. It really does help this channel a lot. I would appreciate it. Thank you so much. Okay, why medical training creates resistance. Why do most doctors resist or dismiss the carnivore approach if the evidence is so compelling? Well, the answer lies in medical education. Nutrition receives minimal attention in medical school, typically less than 25 hours across the 4 years. What little is taught often reflects outdated paradigms based on epidemiological associations rather than biochemical mechanisms or clinical interventions. Doctors learn to manage diseases with medications rather than address their root causes through nutrition. They're trained to view cholesterol as harmful, saturated fat as dangerous, and plants as universally beneficial. This training creates cognitive dissonance when confronted with evidence that contradicts these beliefs. Furthermore, most doctors lack personal experience with therapeutic nutrition. They haven't witnessed patients reverse irreversible conditions through dietary intervention. The result is skepticism that often prevents them from considering approaches outside their training. Addressing common concerns. Critics of the carnivore diet raise several concerns that deserve consideration. Vitamin C deficiency. The most common objection is that a meat-only diet lacks vitamin C, potentially causing scurvy. This concern overlooks several essential factors. First, fresh meat does contain small amounts of vitamin C, particularly in organ meats. Second, vitamin C absorption increases dramatically without dietary carbohydrates competing for the same uptake receptors. Most importantly, vitamin C's primary function in preventing scurvy is hydroxylating proline and lysine for collagen formation. Animal foods provide those amino acids in their hydroxylated form, reducing the need for vitamin C. Despite thousands of people following carnivore diets for years, documented cases of scurvy remain virtually non-existent. Okay. Blood markers. Some carnivore adherents show elevated markers like ferritin or LDL cholesterol. These changes must be interpreted in context rather than against standards developed for carbohydrate-consuming populations. Dr. Chafee reports that many patients see improvements in these markers over time. Others maintain elevated readings without developing clinical problems, suggesting our understanding of these biomarkers may be incomplete. The most relevant question isn't whether blood markers match conventional standards, but whether clinical outcomes improve. A therapeutic approach worth considering. The carnivore diet represents a paradigm shift in nutritional thinking. It challenges us to reconsider fundamental assumptions about human dietary requirements and the role of plants in health. This doesn't mean everyone must adopt a carnivorous diet. Many people tolerate plant foods well and thrive on mixed diets. However, the carnivore approach offers a powerful therapeutic option for those with autoimmune conditions, metabolic disorders, or inflammatory diseases that resist conventional treatment. As research continues to document impressive clinical outcomes, the medical community faces a choice: dismiss this approach based on outdated nutritional dogma, or investigate it with scientific curiosity, sparking new possibilities and solutions. The patients who have reclaimed their health after years of suffering would argue for the latter, inspiring hope and transformation in others. Dr. Chafee frames the issue in evolutionary terms. The type of animal that we are, if we are carnivores, is not just living as such, then we would be getting sick as a result. This perspective invites us to consider whether many modern diseases represent not genetic destiny or normal aging, but the predictable consequences of eating foods incompatible with our biological design. For those suffering from conditions conventional medicine struggles to treat, this insight could mean the difference between managing symptoms and achieving genuine health. The evidence suggests that patients and doctors should reconsider what they thought they knew about nutrition. Our evolutionary past may hold the key to resolving the chronic disease epidemic of our present. Thank you for watching this video. Once again, please leave a comment, ask a question, we'll answer it. If you have an idea for another video you'd like me to follow up on, please leave that as well. Thank you so much.